Session 5, where we are looking at tobacco, still on Unit 6, where we are looking at diseases related to living habits. The previous session we talked about alcohol, but with Session 5 we want to look at tobacco. After going through the session, we should be able to give reasons why people smoke, explain the effect of smoking on health, suggest ways smokers can be helped to stop. Tobacco is one of the drugs which come under stimulants. Remember in our previous session we said alcohol comes under depressants, but for tobacco we are saying that it falls under stimulants. And it contains an active ingredient that we call the nicotine. Tobacco is among the most deadly addictions, and tobacco is used in many forms as sometimes cigarettes, chewed or rolled and smoked as cigars, and many others. Whichever form tobacco is used poses a big health hazard. It is believed the use of tobacco in the form of cigarette has killed more than other diseases. So if we want to compare tobacco to other diseases, then we say tobacco kills more than any other diseases. Why do people smoke or use tobacco? There are a number of reasons, and one of the reasons has to do with, which we say is the major, is the influence of advertisement. If you look at our advertisement, people are made to believe that when you smoke, it increases your sexual drive, it gives you the energy to perform other activities, it helps you to do a lot of athletic work and many other things. And a lot of images that are shown on this advertisement to portray that tobacco is very good. And because of this, people want to explore, people want to go into it and then experience some of the things that are exhibited during the advertisement. There are other reasons apart from the advertisement. Young people smoke because they see their parents do same. Others also claim that it helps them to relax, and many other reasons that they give. Even to the adolescents, they claim that it is out of peer pressure. They want to be part of the group and to be accepted. So if the group they find themselves are smoking, they also indulge themselves in such. It is also a way of rebellion to prove to parents or others that they are in control and that they are adult. It also helps eating less and therefore lose or keep the weight down. That is what other people think. It also reduces nervousness. Smoking numbs the appetite. They think they might spend money on something else if they do not spend it on cigarettes. Smoking reduces boredom. These are some of the reasons that people give as why they smoke tobacco. As we've said earlier on, tobacco contains an active ingredient that we call the nicotine, which is powerfully an addictive drug. So we say nicotine, people become so addicted to nicotine, and normally they become addicted to tobacco because of the presence of what? Nicotine in it. What are some of the effects of nicotine? It has many effects. It affects the body's major organ system, the nervous and hormonal system, the cardiovascular system, and the digestive system. When you take in this cigarette which contains nicotine, that is the work of nicotine, destroying most of the systems in the body. It also triggers the release of stress hormones and so speeds up the heart rate and raises the blood pressure. In general, it also calms the nerves, but some people feel stimulated. It is also supposed to reduce anxiety. It reduces pain, helps a person to concentrate, dulls the taste buds, and reduces hunger. It also has other health-related effects. It damages the lungs, It leads to diseases called the bronchitis, cancer, heart, and other cardiovascular systems are also damaged. Let's look at effects of smoking. Smoking puts pressure on the heart in 5 ways at the same time. Nicotine speeds up the heart rate we've mentioned, and as it speeds up, it increases the heart's workload, so the smoker's heart requires extra energy. And then nicotine also raises the blood pressure. It decreases the amount of oxygen that the blood will have to carry, and then it also triggers the formation of blood clots. Smoking also drastically reduces the blood flow, so it even affects a lot of pregnant women, since there is an issue of clot of blood, since it's an issue of oxygen inflow. As we've mentioned, we have other damages to the organ. It shuts down the circulation in small blood vessels. It causes wrinkling, increases the risk of developing colon cancer. It generally increases the heart attack, and many other. It even leads to infertility. As we've mentioned, we have other damages to the organ. It shuts down the circulation in small blood vessels. It causes wrinkling, increases the risk of developing colon cancer. It generally increases the heart attack, and many other. It even leads to infertility amongst women. It means that if you look at the side effect, the negative effects of tobacco, there is a need for the individual to stop smoking. So how do you give up? You have to, like all habits, it's become so difficult for you to stop smoking. But the first step is to acknowledge and decide that you want to stop. And then believe that you can succeed. Look at the health benefits of stopping, considering to the health hazards that are associated with smoking, and then take quitting as a challenge and plan strategies that you can actually adapt to overcome it. Then you need to find new ways of relaxing. As we said, people use it as a way of relaxing. So find a substitute. And then commit yourself to the activities that will help you to stop, and also committed to stop. Seek help from others. Consider the benefits of stopping. In sum, harmful effects of smoking are the harm it does to the heart and the cardiovascular systems. One can stop smoking with determination, but one needs also to take action and seek help if the one really wants to give it up. Thank you.